Who is the SGB good for?
So, who's the SGB good for? It's a great question. Really, anyone suffering with trauma. Trauma doesn't look the same to everyone, though. And that's important because historically, people think of trauma as military or first responders, maybe assault. But the reality is, anyone that's been through highly stressful situations, intense, chaotic situations, maybe a difficult upbringing, maybe going through a parental divorce, bullying, financial struggles, relationship challenges, any of those folks can struggle with trauma. And with that, they can have a number of different symptoms, from hypervigilance to irritability, restlessness, insomnia. And when you do, oftentimes traditional treatments aren't enough. You get stuck in a fight or flight response. And in those cases, SGB can be tremendously helpful to break through, to get to that next point, and to allow you to start to recover. That's tough. It's different for everyone. Realistically, a lot of people don't know. A lot of people come to us not realizing their nervous system is injured. They have symptoms. They've been told they may meet some diagnoses. They probably have been given a lot of diagnoses over the years of a lot of different acronyms of generalized anxiety disorder and PTSD, but oftentimes they really just feel that their symptoms haven't been fully treated. And often the reason for that is because most traditional treatments focus on symptom management and not root cause treatment. And so if you're struggling with these symptoms, having assessments done, taking a look at what could be the root cause, which often is some trauma that you've been through, really is the first step of determining if SGB is the right step for you.
What is a symptom most patients won't connect with trauma?
So the most common symptom that I see that's not connected, or you wouldn't think would be connected with trauma, is something called fawning. So we commonly think about fight or flight response, which also will add in freeze. So we get this fight, flight, or freeze response. And that's part of our sympathetic system reacting to past trauma. And fight is obvious: irritability, anger, short fuse. Flight, also pretty obvious. You run from danger, you avoid situations, you're phobic of certain situations, don't want to go in a car, a grocery store, etc. Freeze usually involves depression, long hours of sleep, or functional freeze, kind of going through the motions, but no real emotional connection. But fawning is a symptom that's often looked as positive from the outside, because what it is when you're kind of making sure everything else in your life is okay. You're caring for your loved ones, you're helping your family members, you're making sure everyone else's anxiety is controlled and managed. But the problem there is, of course, you're not looking inward. You're not looking at yourself. You're not addressing your own mental health. And it's just like the airplane analogy. You have to put the oxygen mask on yourself first before you can be your best to help those around you. So fawning, I commonly see, tends to be a more maternal instinct, but I see it in all sorts of individuals, and often overlooked as part of that trauma presentation. So one myth is that it's a cure-all. It's not. It's intended to allow patients a buffer, right? If your nervous system is reacting to every situation in a fight or flight way, it makes it very difficult cognitively to move forward in any other way. And it essentially prevents you from healing. When we reset that system, when we balance your nervous system so that you're not reacting to every situation the same way, then you have an opportunity for growth, for post-traumatic growth, we call it. And the myth is that, hey, I'm going to get this block and I'm going to be all fixed. The reality is that's really where the healing starts. So after this block, that's when you want to integrate those treatments. You want to do the psychotherapy. You want to do the trauma therapy, mindfulness practices, breath work. That's when you'll find that those treatments become far more effective and more profound in their benefit. And so keep in mind that this can help a lot of patients, and often it's the opportunity that they need to be able to move forward, but it's not the only thing in trauma treatment. There is a myth that this is something that needs to be repeated regularly. For some, it does. For some, it doesn't. Our data and most of the literature shows that patients can maintain these benefits for months, sometimes years. But I look at it more so as a window of opportunity. Whether it's 2 months or 2 years, in that window, it often gives you that opportunity to utilize those traditional treatments more effectively and then move forward to be able to maintain those symptoms on your own. And if you can't, certainly this can be repeated and there's no harm in doing that. But for many people, if they're able to move forward with traditional treatments, then they don't need this or don't need this as often.